yes, I was saying on number 4, what are the the disparities in health between populations, and that is perpetuated by economic, social, and political force. What's your take on number 4? What's your take on number 4? Health iniquities. Health iniquities. Okay. Anyone else with a different view? Okay. Since there is no different view to that, basically that's the case, huh? Like I was saying yesterday, I was talking of before you advocate against something, what type of injustice is being done to you. So as medical practitioners, when we talk about health advocacy, usually what medical practitioners face or advocate against refers to maybe the laws made by the made by the country or something. Maybe lack of maybe the money they're giving is not that enough. Yeah, basically those are some of the points or the reasons why health practitioners can advocate against them. So the answer there on number 4 is healthy iniquities. Any other addition, subtraction, or we move number 5 or question? Hello. Okay. Silence means we move. Number 5. Dash entails the procedures and processes by which one party justifies and takes responsibility for its activities. What's your take on number 4? Number 5, sorry.
Accountability.
Accountability. Exactly. You just don't do things anyhow. You have to you have to come out to be accountable for it. I remember when we're doing what in grade 9, accountability used to go with transparency. Is it grade 9 or grade 12? Civic education, maybe it's grade 12. Yeah. You have to be accountable to something. What do? When you give someone medicine and that person dies, you're going to be accountable to the death of that person. Why did the person die under your care? Yeah, so basically that's the definition for accountability. Okay, next there are questions there. We can move on number 6. Outline the 3 essential components of accountability. What are the 3 important components of accountability that you know? Okay. Chat box. Okay, that's what those 3 elements mean. What do they mean? What do they mean? What do those 3 elements mean? Hello? I think vocal yes can be okay. If it won't be a problem. Yes, because typing will take time, so I don't know if it's okay if you can do it verbally. It's a problem. Okay. Anyone to assist Lady Rag on that one? Anyone to come out? Okay. Since I don't want to waste a lot of time. So when you look at just like she has said, there is yes, Dr. Shooton, you can come in.
Okay, this when we talk about launching of accountability, this simply means about in someone taking the responsibility, whereby when you talk about in DME notes saying about it consists about 11 parties which are accountable to held, yeah, like that. And then when we talk about the domains of accountability, it's it's just scatters about the only like those 6 activities whereby for none for what's this, what can I say, mm, what can I say here, uh okay, in simple terms I can say is that it's consists about 6 activities like for domain like financial performance, yeah, like financial performance. Even you have to, okay, there are many, okay, like maybe we could end up with that. And then there's a procedure of accountability where which the one which involve about the informal and the formal evaluation, yeah, and the, yeah, evaluating the response by the accountable parties. Yeah, I think maybe if there's more explanation, I can do more. I think that's all I can able to say.
Okay, thank you very much for that, Dr. Shooton. So exactly like he has put it. When you talk about loci, LOCI, loci. Remember when we're talking when we're doing when we found this term in biology. In fact, even in math, get 12 math. So when you talk about loci basically looks at the location or the specific place that contains something, isn't it? Or the position, so to say. So when you look at loci, we are looking at the specific people that can be accountable to something, and we're looking at the officials or the other people, the other group of people that can account those people. Let me say in Zambia we have the ACC that hold people accountable for what they've done and how they're spending their money and if they stole money. Hope you're getting the concept there. Then look at the other one, which is domains. Which is domains. The domain basically looks at that medical health practitioner. What what type of accountability are we going to look at? In life there are different sectors of life. There is the financial aspect of it, there is the emotional aspect of it. It is the same when it comes to the healthy part of or the yeah, the healthy sector, so to put it. We are looking at how different sectors of that, are we going to hold that particular health professional accountable maybe to how they have been spending their money, how they have been doing their work, how they have been um, relating to patients, and have they stolen something, the legal aspect of it. So basically, that's the domain point of view for accountability. And the last one is the procedure, just like the way Dr. Shulton had explained. How are you going to do it? How are you going to hold them accountable? There is the formal aspect of it and the informal aspect of it. How can the formal aspect of it? This is where I drag you. We take each other to court. Maybe we even put in the law enforcement agencies to help with accountability. Or informal, where I can just come and talk to you and tell you, you're on a boy. Boy. Have that conversation with you. So basically, those are some of the way be enforced, so to say. Unless there are questions on that one, we can move to the next question. Are there any questions? Because those are the components of accountability you're supposed to take note. So you can remember them as the L, LDP. Number 7, which component of accountability entails that health care consists of different parties that can be held accountable or hold others accountable? I feel like number 7 is tautology of number 6. So what's your take on number 7? Okay, thank you. Unless there are questions, the answer there is loci. I've already looked at that. That was the first part of the components of accountability, the loci. Any questions? Or we go on 8. Okay, number 8. Domains are areas of accountability. State the 6 areas of accountability. So basically, there can be many areas of accountability, but in this document, they want 6. So I can hold you accountable in many aspects or many sectors or many areas, but we are looking at what are some of the accountability sectors that a party that is holding another party accountable on, with respect to health, can enforce the accountability. Yeah, what's your take on number? Is it number 8? Yeah, number 8. Okay, number 1 from Lady Luck is professional what? Professional competence. How is the person working? Are you fit for the job? Have you been working according to your medical ethics? Yeah. Anyone else?
Community
Number 1 is
benefit.
community benefit. Is your working reachable to the community, or are you the type of medical practitioner where a member of the community, when they come and they come for assistance or work, you don't give them, you'll be telling them, wait first, tibe panado pan. Are you that type of a medical practitioner? Are people benefiting from you being part of the community as a medical practitioner? Anyone else? Okay, Dr. Shiro again is saying public health promotion. Public health promotion. Is your work promoting health in the community or outside the community? Okay, the other one from yes, where was I? I was talking about the legal and ethical conduct. The legal and ethical conduct. I think I've explained the ethical conduct in one of the other what? Yeah, then the ethical part of it and the legal part of it. Okay, they've plot them out like that. Is what you're doing with respect to what the law commands you to do. Are you a good citizen? But I've been stealing money by looking at the financial performance. Are you a thief in the medical field? No, so basically, there are many different ways in which you and I can be held accountable on or to with respect to accountability in medical health. Yeah, so it is quite important for you to discover when you understand the ethics and you understand you have to be a good citizen as well to understand the law of the country. That's when you can become. That's when you can set yourself free from accountability issues. Otherwise, if you're not a good citizen, you don't know what the law states, and you have not studied your ethics nicely, to be quite hard for you to be safe from accountability from those parties that hold accountable medical practitioners. I hope we have gotten the point there. Doc Faith, Doc Lombe,
Yes.
Doc Diana, we have gotten the point there, isn't it? Okay, so the next question is a dedicated question to Doc Chirofia. I haven't heard your voice. I don't know if it's your voice. Yeah, I haven't heard your voice, Doc. I don't know if it's a he or a she. I'm sorry, I don't know her gender. Yeah, Doc Chirofia. Question number 9 is dedicated to you. I don't know if you're in. Dash includes formal and informal procedures for evaluating compliance with domains and for disseminating the evaluation and responses by the accountable parties. Dash includes Dr. you're welcome. Dash includes formal and informal procedures for evaluating compliance for
Oh, it's a
for evaluating
female.
compliance. It's a female. Okay.
Yeah.
Okay, thank you, and sorry for not knowing your gender. Doc, Doc Chirufia, this question is for you. What do you think is the best
Procedures.
solution to answer that? Yes,
It's procedure since it involves the informal and the formal part of evaluating
exact.
the same question.
Hello. Dr. J.I.N.
Exactly. Thank you very much. So, procedures. One of the aspects. Okay. Thank you. We are ending on question number what? Number 10, isn't it? We are going on question number 10. Is Doc Melvin out? Hello.
Hello.
Okay. Thank you. Can someone help us with the screen? Unfortunately, I can't share my screen. Can someone help us with the sharing of the screen? I want to go on question number 10. So,
Mufista shani can see if you're sharing screen, eh?
you can just click on those my three dots, Doc. That my three dots. Yeah, there's some three dots after the raising of the hand. That my three dots. I don't know if you have clicked on them. But then when you click on those my dots, there is a part where it's showing share screen. That's where you click. Okay, exactly. Thank you very much. We can now see your screen, Doc. Who is sharing the screen? I'm confused now. Is it Doc Melvin or Doc Roman? Or is Doc Melvin now? Okay, thank you.
Kindly put it in landscape.
I'm still in. Okay. You can just okay, you can just swap you can just put in landscape, Doc, so that people who are going to be watching this recorded version of the meeting can also be able to to view the questions. Doc Melvin, is it me or maybe you avoid landscape? Then it's only me who is not having seen the landscape version of it. Hello? Are you in Doc Melvin or Doc Rumuno should overtake? Okay, I think maybe he's out. Doc Rumuno, you can overtake.
Hello.
Yes, Doc Melvin.
He's here.
Okay, Doc Melvin, are you having issues with sharing of the screen so that you can be overtaken? I don't know if that word exists. You can be overtaken by Doc Romono. Hello. Okay, I think his network is maybe tripping. Doc Romono, you can share. Since Brighton take off. Doc Robert, violence here. Okay, thank you. Yes, we can see your screen, Doc. Okay, thank you.
Just put it in landscape.
Yes, Doc Romono, you can just put it in landscape, just like Doc Cyril was saying. Okay, thank you. Okay, much better now. I'm sure those that will be seeing the video, the recorded video, will be seeing the questions nice. If you not see by the time you'll be viewing this video, if you won't be seeing, then you inbox us to help you see nicely. Okay, number 10, the complementary. Is it number 10? Okay, yeah. Number 10, the complementary relationships among organizations and occupations in healthcare, including integration, networking, coordination, resulting in the joint production of goods and services is called. What should take on number 10?
Cooperation.
Exactly, cooperation. Cooperation. Complementary based pair. I almost said that. Yeah, biology. Yeah, so basically, it's cooperation actually. I remember in grade 9, my RA teacher used to shout it as cooperation. Yeah. So when you talk about cooperation, we're talking about the joint teamwork, I would say. Yeah, we already did teamwork skills, so I won't even go into that. But a joint work, a joint networking, a coordination. So just see that when you just see the term coordination, you can only coordinate when you are cooperating. So number 10 is cooperation. Hope you guys are getting out of the answers, cause yeah. Number 11. What are the 4 ways in which health care can be made effective? Yes, you can pronounce it differently, Doc Breton. It can be cooperation, or you can even put yeah. I'm sure Doc Rumuno, if you can speak Tonga, you can pronounce it nicely. Then Doc 11, then question 11, sorry. Question 11. What are the 4 ways in which health care can be made effective? So there are many ways. There are many ways that you can make health care effective. But what are some of the ways you think health care can be made effective?
what are some of the ways in which you can make healthcare cooperation effective? Yes, Doc Victor, I wanted to say something. I could see your mic was. Yeah, if you want to just say something, you can just maybe raise your hand. Yeah, because I can see there is an option for the hand somewhere there that we can be getting out of. Yeah, getting out of you if you want to say something so that we don't. Okay, effective communication. Yes, exactly. How can you have cooperation when there is no communication there? Is it my network or maybe the Kurumuna screen is no longer showing? Hello?
It's no longer showing.
Okay, it's back. Okay. Okay. It's like the Kurumuna screen. Okay, Doxilo is now sharing the screen. Okay, thank you. Okay. Dr. Lumuna, you can come back now to the chat box. Dr. has overtaken you. A lot of overtaking you. Number 11.
Stop.
You can just click on the same.
It has already stopped for you.
It has even stopped already. You can just come back. Since I've already been overtaken, someone is already on the. Yeah.
Okay.
Is already driving now. You can just come back. I don't know if you can.
I'm
See
here.
the screen. Dr. Lumuna, you were saying something? You were saying something before I cut you?
No, I was saying that no. No.
Okay, thank you. Okay, I was saying, yes, effective communication is one. That's the reason why we rent communication. You cannot work nicely if there is no communication between you guys. It's quite important for you to have a communication first. That's why it's important for you to understand communication, the notes for communication to the fullest, because that's the only way you can work on your teamwork skills and your cooperation skills. Okay, any other answers to that? Yes, the pace is very impressive indeed, Doc. We were actually on question number 10. We are going to finish by 21. We started at 21:10, if I remember nice. So by 21:05 we're supposed to be done. What are the 4 ways in which healthcare can be made effective? What do you think? Not even look at the notes. Not even tell me just tell me from your view. What do you think are some of the ways in which effective cooperation can be enforced? If someone was just to come and ask you this question from your sleep, what would you tell the person? You know, DME is an interactive course. It's not basically from what the notes say, like biology or chemistry. It's basically from what you feel, what you think. Okay, okay, since I don't want us to waste a lot of time on this, so some of the honesty and humility. Okay, yes, if you're honesty, if you're being truthful to what you're doing as a medical practitioner, that will add to the effectiveness of the cooperation. Okay, let me just sum up quickly on the ones that you might find in the notes. There is you have to give specific roles to the different team members. Remember, when we're talking about teamwork, each person has to have a specific role in the team or in the group. So it's basically the same case with cooperation, like I had said. When we offer different works to each member, the cooperation, because the main purpose of cooperation is to increase on the productivity of goods and services, but on on the aspect of the healthy care system. We're just looking at the productivity or the enforcement of fast and quick healthy services. So if you give specific laws, this is the reason why when you go into a clinic, you're going to find there is one who is working on the pharmacy side, there's the other one who is doing the BP, there's the other one who is offering to my books, there's the other one. I don't know if they still offer books. They still offer books nowadays. Has it become technical? Then there's the other one who is with the COVID era now. There's the other one who is offering to my sanitizers. Then there's the other one who is doing my BP checkup. So basically, like work is divided. If we were to give one person the entire work, there will be no productivity because the person will be worked up to with the issue of with the issue of productivity to slow down because one person will be required to do almost 5 works, So that's why we have the issue of assigning each person particular work. Yeah, and also respecting the work that each individual does. Just because you're the one who is giving the parados and the piditons doesn't mean that you have to disrespect the one who is doing the BP checkup or disrespect the other one who is doing the sanitizers. You're supposed to respect each member because they hold a very important work in the team or in the cooperation. Or in the cooperation team. So to say. Unless there are questions on that one, we can move to question. Are there any questions? Are there any questions? I don't want to be a preacher man. I want to be getting some feedbacks. Hello, Doc Faith, Doc Gift, Doc Jovis. Okay, thank you. We'll go on question number 11. Okay. Is it 11? Okay, thank you. It should be 11. No, 12. Question number 12, sorry. Nurses, pharmacists, and pharmacists and policymakers are good examples of what? I think I already gave an idea of what the answer should be there. What do you think? Let me check the chat box. What name do we give? What name do we give to the nurses, to the healthy care team? Am I giving what do you name? Okay, so I think I left some minutes. Sorry about that. What was your decision? Okay, Lady Luck is saying healthy professionals team. Those guys that the 11 people that you find playing football, you call them what? You call them a football team. Yeah. So even when it comes to the issue of the healthy sector, those people that particularly deal with health related issues, they are called a healthy professions team. Okay, yeah. So we can go on question number 13, unless there's an addition, subtraction to this. So we're saying healthy policies that are implemented by the administrators and provide oversight of health professionals and are necessary part of the health care team are made by. Where are the rules made for, or where the regulations made for the health care teams? Who makes the rules and regulations? Who tells the doctor what to do and what not to do? Policymakers. I feel like the answer was even in the question, wasn't it? It's even in the question. When you just look at the question, who can make a policy apart from a policy maker? Mm-hmm. Who can judge you apart from a judge? So basically, even in the question, so that's the reason why it's be careful with the question sometimes. Even in the question, you see the answer. Any questions on that? So basically, when you, an example of
Wait.
yes, Dr. Melvin.
You're
Yes,
on
Dr.
question
Melvin, you
number
can
what?
continue. We're on question number 13.
18, and the question is
Health policies that are implemented by the administrators and provide oversight of health professionals and are necessary part of the health care team are made by. Who makes the rules and regulations?
healthcare team or health professional team.
Yeah, that was the answer for the previous question. So in this one, we said the answer is supposed to be policymakers. Yeah, so it's basically policymakers, and an example of policymakers that we look at is an example of them that we look at is what? Yeah, I don't know if you have heard of the HPCZ, the judiciary. I don't know if you have heard of those guys. They can classify them as being part of the policymakers with respect to the health care system. Yeah, the HPCZ is Health Professions Council of Zambia. Should be, I think that's what it means. Should be located just near on the other side. Yeah, I mean, you can go check out the place if you want. Yeah, so basically those are one of the policymakers that we have. They basically have the power to make the ethics of the regulations that you guys and that me myself we are supposed to follow as medical practitioners. You can go on number 14. Dash refers to the delivery. Okay, yes, Dr. Victor, you can ask.
Yeah, I wanted to find out. Is it a must that these policymakers come from the government, or they can be non-governmental?
Okay, thank you for that question. Anyone to come on board to answer Dr. Victor's question?
They can come from both.
Okay, Dr. Melvin is saying they can come from both.
Oh.
What are others saying? Yes, Dr. Melvin, I can get you. Can you go deeper on that, Papa Melvin? Why are you saying they should come from both?
Because those who are non-government organization are more like the observers what the government is doing. Is it health for the people? Is it safe for the people? Just like that.
Okay. Okay, thank you. From my view, I feel like mostly the ones that have usually have the power in the country to make the rules and regulations are the ones that come from the government. But just like the way Dr. Melvin has said it, both. I wouldn't say both, but I would say it's the government. But just this topic is basically based on two things. In fact, three. I would say three. This tutorial sheet. It's based on advocacy. It's also based on accountability, and the other one is cooperation in the healthcare system. So I'll put it in this way. Basically, they come from the government, but because of the fact that there is advocacy there, this is where the non-governmental organizations come in. This is where they come in, the non-governmental organizations, where now these non-governmental organizations come in to influence the decision of the policy makers. I don't know if you're getting me on that one, Doc. Where let me say, if maybe some of the policies that were made by this government policy makers, maybe they're not in favor of the community. Okay, I'll come to that question, Dr. Anna. Where maybe one of the policies that they made, they didn't like them. That's why now the non-governmental organizations can come in and advocate against those policies. There are some policies that are not even made by the government of the country. Like they come from the United Nations, UN, but there are policies that the World Health Organization, WHO, makes those regulations. Then, yeah. So basically, I would point it out that it can be both in some cases, and in some cases, it can just be governmental. I don't know if I've answered your question, Dr. Victor.
Yes, you have. Thank you so much.
Okay, thank you. Then let me check.
Yes, actually, just an add-on.
Yes, Dr. Sido.
Yes, actually, the HPCZ is the only body in Zambia that is mandated to make policies. Okay, of course, we can have different ways in which we have policies, but outrightly, the HPCZ has the power. Okay, it has the power, and it is actually a regulatory body that has been established by the Health Professions Act of number 24 of 2009 of the laws of Zambia. So it's actually one of its functions to regulate even the licensing, the accreditation, and even recognizing a particular training, whether it's an approved training or what. Yeah, so that's the case. The HPCZ has the outright mandate to do that. And all these my NGOs and others, all what they do is just to advocate. They start making noise. They start whether it's rioting or whatever they do, but they do that in a professional manner, just in order to advocate for a certain policy or against a certain policy, if that affects either the human rights or the rights of the workers or the patients, whichever may be the case. So yeah, basically, all what us as individuals and the justice at large, you all just advocate and not really enforce the policies. Yes.
Exactly. Thank you for that, Doc. Yeah, I hope I've gotten that point. Basically, we can just advocate, just like the topic was saying in the beginning. You can advocate with health inequities. Maybe they're not teaching you nicely. You feel like they're not teaching you nicely. You're supposed to advocate. You cannot make a policy, but advocate against a policy. But there is a policy maker that has a mandate to do that. So when you go that side, so I don't know if you remember with the with a protest. I don't know if I'll call it a protest, but I'll call it an advocate that the 700 resident doctors went to do. Yeah, so basically, in the beginning, they started with by HPCZ because they knew that those are what the policymakers of maybe them being employed and stuff like that. So basically, that was an advocacy. Those 700 medical doctors did not just make the decision of saying, no, I'm going to be working from tomorrow. I'm going to, because I have a degree, I'm going to make a policy of let all those that have graduated be employed at UTH. But no, they had to go and advocate against them being unemployed. Okay, then there is before I get to Doc Faith, I've seen Doc Faith as done. Yes, Doc
There's a
Sidiro, you
question
can.
here.
Okay.
Is it Dr. Diana? It says, do the policy that the government makes apply to the private healthcare organization? Of course they do. I would just I'll send. I think I'll send the code of ethics in the group, and I'll just like to read to you just a paragraph, and this is just on page 2 of the same code of ethics, and it reads as follows: This code of ethics applies to all health practitioners whose call is to practice. No, not this one. Not this one. Not this one. The other paragraph. Okay, yeah. The Code of Ethics covers professional conduct of all registered health professionals, apart from the nurses who are covered in a different act. Of course, the nurses are also covered, but they are also covered in just a different act. The Code of Ethics further covers all practitioners employed in public and private sector, including all those in faith-based health organizations, in brackets, mission health institutions. So it covers everyone as long as you're practicing health. In short, as long as you're providing health care, you are covered at whatever level, whether a nurse, the exclusion of a nurse is just that on this particular act or paragraph, they want to talk about other health practitioners apart from nurses. But otherwise, even nurses are also covered in a different act, but still under the same code of ethics. Yeah, so basically they're also covered by the same policies.
Exactly. Thank you very much for that, Doc. So whether you came from Monza or from Jantemba College of Medicine, as long as you are just someone who has done medicine or nursing or any other related health work, whether pharmacy, as long as it's something that is recognized as healthy, you are obliged to follow the ethical the ethics that a medical practitioner should follow, that are being given or being directed by the HPCZ and the WHO. Okay, unless there are questions on that one, yes, even those from KSO, as long as you're a medical health practitioner, you're accountable to the domain of the health standards that are written down in the code, just like Dr. Sula said. Anyone? Okay, I hope that has answered your question, Dr. Diana. Or you have anyone has a question? Okay, Doc Faith, you can come in. Yes,
I just want to find out what does the same. Yes, I just want to. Oh, what does the letters HPCZ stand for?
Okay, I think I'd say that, though I wasn't 100% sure, but wherever you see Z is Zambia.
Health Professions Council of Zambia.
Okay.
Health Professions Council of Zambia.
Okay, thank you for that, Doc. Yes.
For the query of sending the hostess, I'm sending it. Actually, that's the first icon. The first logo on the same first page of the document I'm sending.
Okay, thank you very much for that, Doc. So you guys get to lead these documents. Get to have a touch of them. It's very important. Well, at that point where you're relaxing from studying my biology, my chemistry, just check out DME. The Earthy Professional Council of Zambia. That's what HPCZ is. You can just go and check out the place. It's a nice one, actually. You'll find the flag there in good shan. It's a nice place there. Just go and check it and go and ask them. You can even go and advocate for those that choosing 2,500 of you for medicine or for nursing or for whatever. You can go and advocate. That's right. For question number 14. If there are no questions, we can go on question number 14. Okay, dash refers to the delivery of evidence-based medicine and how it can be provided in a fashion that is efficient, equitable, and cost-effective. What is this? What are we looking at? Is that looking at surgeon? They will look for a lot of things. They look for a lot of things from you. Those things, they have ethics. They ask for lab results. And you'll see. Let's look at question number 14. DME. Look for a CA. They'll mark you before they give you the final exam. They'll mark you themselves. Well, okay, health care. Exactly. So we're looking at are you offering? You know, it's quite important. This is the reason why they brought DME for us in term what in first year because of the bad healthcare system that the previous students received because they just started. No, DME was something that medical health practitioners used to learn from. It should be fourth year. Let's look at it from fourth year. Now us was starting from first year because they want us to be equipped with this. We have to have that good communication skills with patients. Like it was a known thing that when you go into a hospital, a doctor or a nurse will not talk to you nicely. But they want to change that view. They want the community to look at the hospital as a friendly place, you know, like a place where you can even go to. No, initially a hospital, a clinic is not supposed to be a place where you go when you're just sick. This is a long perspective of a clinic or hello. Maybe one better I want to see you. What's up with your network? Doug Melvin. Yeah, so I was saying when you look at an health institution like an hospital, like a hospital or a clinic, you're not just supposed to go there when you're sick. That place is meant for you to even go for sensitization. You go and ask them deep questions that you can ask them. How can I abstain from this? How can I keep myself from this? That's one of the functions of a healthcare facility. If I was to ask each one of us, when was the last time you went to a clinic to go and ask them about how you can live safe as a human being? I don't think I can get a yes response on that because I'm sure we don't do that. So that's one of the reasons why DME was brought, so that we can have a good healthcare mentality or healthcare development skills in us as medical practitioners. Unless there are questions there, we can move on question number 15. Any questions, additions, subtractions? Okay, they can go to the last one and we call it a night. What act was being done by a medical practitioner who asked himself the following questions when attending to a patient? How might this make a person feel? Or how does it feel to be kept waiting? On number 14, we said healthcare system, healthcare. Dr. Maya, you're welcome. You're right on time. We need someone to close for us. Yeah, so I was saying, have you ever gone in a clinic before and you stay there waiting like you're in a bank? You stay there waiting to be attended to. Then you're having a fever or something. I don't know if you have experienced that, but I think I've experienced that before. So practically I know how it feels. I can relate to this. So I don't know if you guys have ever felt it before. Yeah, so we're looking at the question is what act was being done by this medical practitioner who asked himself these questions. How can I feel if I was the one who was waiting? Hmm? How can I feel if what is being done was being done on me? What type of experiment was this being done? Exactly. He was practicing health care, the system, but practically what he was looking at was the aspect of caring. You know, when we're looking at therapeutic communication, we were looking at the aspect of empathy. I don't know if you remember that part on empathy, where we were looking at the aspect of putting yourself in their shoes first before you judge them, before you criticize them, or before you conclude on something. You put yourself in their shoes. So I want to use that same concept of therapeutic communication to the to the fact of the healthcare system. So you have to have that empathy of putting yourself in the shoes of the patient before you actually do something or before you practice something. So when you care for the when you put yourself in their shoes, you're going to ask yourself questions like, if it was me who was sick like this, or had a fever or malaria, then I was kept waiting for an hour, how would I feel? That's when you become a true medical practitioner, because you're practicing the aspect of caring. You can only think of that when you're caring for that individual. So you can only care for a medical practitioner, sorry, for a patient, when you have experimented or have applied the aspect of caring, which is more of an example of empathy. That is a therapeutic communication that we already looked at. Yeah, so you can only care for someone if you understand them, if you can put yourself in their shoes. I don't know if you get that point. I can only care for you if I understand what you're going through, if I put myself in the shoe that if it was me who's going through this, how would I react or how would I feel? That's the only way when you can care for someone. So basically the answer to question number 15 is caring. Unless there are questions on that one. Any questions, additions to question number 15 solution?